Welcome back, everyone, to the deep dive. Today, we're diving into maximizing ROI on ambulances and mobile clinics in Africa.
Okay.
And to help us with this deep dive, we have an expert joining us today.
Hello.
I'm really looking forward to this one because I think this is a topic that everyone in healthcare can relate to,
Yeah.
especially in Africa.
Yeah, it's particularly relevant in Africa where, you're talking about limited resources
Yeah.
and a very high need for healthcare access in remote and underserved areas. So
Right.
it's kind of the perfect storm where mobile healthcare comes into play as like a really essential tool.
Absolutely. And I know we're going to get into the specifics of how to make that work really well.
Yeah.
But first, I'd love to get your take on just the overall global landscape of mobile healthcare. What are some of the big trends that you're seeing in this space?
Yeah, I think one of the most exciting trends is that mobile healthcare is finally getting its due. I mean, it's always been around,
Yeah.
but now we're seeing it really starting to be recognized as an essential part of healthcare systems all over the world.
Yeah.
And that's reflected in things like, health policies,
Yeah.
where mobile healthcare is actually starting to be considered as a real solution for reaching populations that have been historically underserved.
So it's not just kind of an afterthought.
No.
It's actually being integrated into
Exactly.
the plans.
Exactly. It's becoming part of the plan. And I think that's really encouraging because it shows that policymakers are starting to understand the potential that mobile healthcare has.
Right.
And, one example of that in practice is Zambia.
Right.
They've actually implemented a really interesting initiative using mobile hospitals to bring healthcare to rural communities.
Wow, that sounds ambitious.
It is. It's a big undertaking, but it's also a really important one because it shows a commitment to reaching everyone, regardless of their location. And, their experience in Zambia highlights a really crucial point.
Okay.
Just having the mobile units is not enough. You need to be strategic about how you deploy them.
Well, that makes sense.
And how you allocate resources to make sure that they're sustainable.
So it's not just a matter of like,
Right.
oh, we bought the ambulance, we're good to go.
Exactly. It's
Yeah.
not just about buying the equipment. You have to think about things like staffing
Yeah.
and maintenance and, fuel costs. And that was actually one of the challenges that they faced in Zambia. The operational costs of running the mobile units were quite high,
I see.
which unfortunately limited the duration of their outreach programs. So it's a reminder that we need to be mindful of operational efficiency
Right.
if we want to make a lasting impact.
That makes a lot of sense.
Yeah.
Because if the unit's not out in the field,
Right.
it's not doing anyone any good.
Exactly. And
Yeah.
it's not generating that return on investment.
Yeah. So how do we make sure that these programs are cost-effective
Right.
and efficient? I mean, one thing that jumps to mind for me is preventative care.
Yes, absolutely. Preventative care is one of the areas where mobile clinics can really shine, and it can lead to some pretty significant cost savings down the line.
Makes sense.
Because, if you can catch things early,
Yeah.
you can prevent more serious and more expensive health problems from developing.
Right.
So things like hypertension, diabetes, high cholesterol. If you can screen for those and manage those conditions early on through mobile clinics,
Right.
you can potentially prevent those costly trips to the emergency room,
That makes sense.
which ultimately, improves long-term health outcomes.
That's great.
Yeah.
So do you have any examples of programs that have actually successfully implemented this approach?
A really great example is the Family Van program in Boston.
Okay.
They've been focusing on preventative care for years, and they've managed to achieve
But
an incredible return on investment,
really?
like a 36-to-1 return on investment.
Wow. That's amazing.
Yeah, it's pretty remarkable. For every dollar they invest in the program,
Yeah.
they see 36-to-1 returned through avoided emergency department costs and lives saved.
Oh my gosh. So that's a message that I think a lot of healthcare administrators and procurement officers
Right.
need to hear. Like, this
Right.
is not just about good healthcare. This is about
Yeah,
a smart economic strategy.
exactly. It's a win-win situation. And it really ties into that need for strategic deployment that we were talking about earlier. It's not just about having the mobile units. It's about getting them to the right places at the right times with the right services.
Yeah, like we were talking about with Zambia,
Exactly, like Zambia.
that they had to cut their program short
Yeah.
because they didn't have the resources to
Right.
keep them running.
Exactly. So it's about optimizing every aspect of the operation to maximize efficiency and ultimately that return on investment.
Yeah, like it's a carefully choreographed dance,
Yeah,
making sure all the pieces are moving together
exactly.
smoothly.
Precisely. And speaking of optimizing operations, we can't forget about the role of technology.
Okay, so we're not just talking about like fancy gadgets here.
Yeah.
How is technology actually making a difference on the ground in these mobile healthcare settings?
So technology is really transforming how we deliver healthcare through mobile units.
Okay.
And we're seeing platforms like Medalert Connect and Medalert Responder,
Okay.
which are designed to streamline the entire operational process.
Oh, wow. So tell me more about that.
Yeah, so think about things like optimized ambulance routing and dispatch.
Okay.
So making sure that ambulances are getting to patients as quickly and efficiently as possible.
Huh.
You've also got improved billing processes, so no more, paperwork headaches,
That's great.
enhanced communication between teams,
Right.
so everyone's on the same page, and better tracking of key performance indicators.
Yeah, so we can actually see
Right.
what's working and what's not.
Exactly. It's
Yeah.
about reducing wasted time and resources,
Mm-hmm.
which, directly impacts the bottom line.
I like where this is going.
Right. And all of this really feeds into the larger move towards value-based care. It's about demonstrating the concrete impact of your investment, not just in terms of cost savings,
Yeah.
but also in terms of improved health outcomes for the communities that you serve.
So it's about the people
It's all about the people.
at the end of the day,
Yeah,
right?
absolutely.
So we've talked a lot about technology, but technology on its own can't really do much.
Right.
We need people who are skilled to operate these mobile units to deliver the quality care.
Right.
So where does staff training and development kind of fit into this whole picture of maximizing ROI?
Yeah, staff training and development is absolutely crucial. A mobile clinic is really only as good as the people on board.
Makes sense.
So we need to make sure that we have well-trained medical personnel.
Yeah.
Of course. But it's not just about doctors and nurses. We also need to think about the drivers,
Okay.
the administrative staff. Everyone on that team needs to be equipped with the right skills and knowledge to deliver a really seamless and efficient service.
So it's about empowering the entire team to be able to perform at their best.
Exactly. Yeah. And, it's about investing in your staff just as much as you invest in the technology because they're both equally important.
So are there any specific areas of training that you found to be particularly valuable?
Actually, if you think back to that Australian cost-benefit analysis we talked about earlier, they highlighted the positive impact of nurse-led primary healthcare facilities.
Oh, interesting.
And, these nurses, they played such a vital role in delivering those essential promotive and early intervention services.
Okay.
So it just goes to show that with the right training, nurses can really enhance the reach and impact of mobile healthcare.
That's a really good point because I think traditionally we think of
Right.
doctors needing to be the ones to deliver care.
Right.
But if we can train nurses appropriately, then they can really
Yeah.
help extend those services out.
Absolutely. And, it kind of challenges that traditional model and shows that we can expand the scope of care that's delivered through mobile units.
So we've talked about technology, we've talked about staff training, but what about the community itself? How important is community engagement in maximizing the ROI of these programs?
Oh, community engagement is absolutely essential.
Okay.
You can have the most advanced mobile clinic,
Yeah.
the most skilled staff.
Right.
But if the community doesn't trust it, if they don't understand its value, it's not going to be as effective.
Yeah, that makes sense. Because if people don't feel comfortable using the service or they don't see it as being relevant to their needs,
Exactly.
then it's not really going to have an impact.
Yeah, it's going to have a limited impact.
Yeah.
So we need to make sure that we're building that trust.
Okay. So how do we do that?
Yeah.
How do we effectively engage communities and build that trust?
I think it starts with building bridges. Engage with community leaders.
Okay.
Conduct needs assessments to understand their specific concerns and priorities.
Right.
Tailor services to meet those needs.
So it's about understanding what the community actually wants.
Exactly. It's about treating communities as partners in their healthcare, not just passive recipients.
I love that.
Right. It's about making them feel like they're part of the solution.
Exactly. And when communities are actively involved and invested in a program, it becomes much more sustainable in the long run. Which brings us to another really important point.
Okay.
Financial sustainability.
Right.
We've got to make sure that these initiatives can operate for the long haul.
Yeah. And I think back to our conversation about Zambia earlier.
Exactly.
They really struggled with that, having high operating costs. So what are some strategies for building really robust financial models that can actually support these programs?
Right. There's no single solution, but there are several avenues that we can explore. Of course, we have the more traditional funding sources like government support, public-private partnerships, donor funding.
Right.
Those all played a really important role.
Okay.
But we're also seeing a rise in innovative financing mechanisms.
Oh, interesting.
That can leverage the cost savings achieved through preventative care and reduced emergency department visits.
So it's almost like the program's own success in delivering cost-effective care can actually help to fund its future success.
Yeah, that's a great way to put it. It's about creating that virtuous cycle where positive health outcomes and cost savings, they reinforce each other.
Right.
And, it's important to remember that maximizing ROI isn't just about the numbers.
Yeah.
It's about driving positive change for the communities that we serve.
I feel like we've covered so much ground today. Yeah. Everything from global trends to like nitty-gritty financial models. So for all of our listeners out there who are working hard to improve healthcare in Africa, what would you say is the one big takeaway?
Well, I think the big takeaway is that mobile healthcare has huge potential.
Especially in Africa. But to really make the most of it, we need to take a really holistic approach. It's not just about, providing services. It's about maximizing the value of those services through careful planning, strategic investment, and a deep understanding of the communities that we're serving.
So it's like building a whole ecosystem around those ambulances.
Exactly.
And mobile clinics, making sure that they're delivering the right care at the right time in the right place.
Exactly.
Yeah. That sounds like a pretty big challenge.
It is a challenge.
But I imagine also incredibly rewarding.
Oh, absolutely. It's so rewarding to see the impact that these programs can have.
So for our listeners who are ready to take that next step,
what's
one thing that they can do right now to really start maximizing that ROI?
I would say take a step back and look at your current operations with a critical eye.
Okay.
Ask yourself, are you prioritizing preventative care? Are your mobile units deployed in a way that maximizes their reach and their efficiency? Are you using technology to streamline your processes? And maybe most importantly, are you truly engaged with the communities that you serve? Because those are the questions that are going to help you identify areas where you can improve and really make a difference.
It's about asking those tough questions and then being willing to adapt.
Exactly.
And innovate based on the answers.
Yeah.
I like it. So it sounds like there's a lot of opportunity here.
Oh, there's so much opportunity.
To really improve things.
Absolutely.
That's great. And I think it's important to remember that our listeners aren't alone in this.
Right.
There's so many organizations, individuals who are working on this same problem.
Exactly.
So what advice would you give in terms of, connecting with those people and learning from each other?
I think the best advice is to reach out.
Okay.
There's so many resources available.
Yeah.
Organizations, conferences, online forums. Connect with people who are doing this work.
Right.
Learn from their experiences. Share your own. And together we can build a future where quality healthcare is accessible to everyone.
That's a great message to end on.
Yeah.
Thank you so much for joining us on The Deep Dive. We hope this episode has given you some valuable insights and some practical strategies that you can take back to your organizations.
It was my pleasure.
And remember, maximizing ROI isn't just about financial returns. It's about building a healthier future for everyone.
Absolutely.
Until next time, keep diving deep.